Hello, my name is Allison Nguyen, and my literature review is on cytoreductive surgery, which is used to treat ovarian epithelial cancer. So, ovarian epithelial cancer is where cancer forms in the tissue that surrounds the ovaries. And in its most advanced stages, the cancer can spread not only to the ovaries but also to the rest of the body. And with cytoreductive surgery, the surgeon goes in and tries to remove as much of the tumor as possible. And with this type of cancer, a combination of treatment is usually used in the form of chemotherapy and surgery. Although there are many effective types of ways to treat this cancer, cytoreductive surgery is essential in trying to eliminate the cancer and is most effective when trying to decrease or eliminate the tumor. So with this literature review, I explored three main themes, the first being the stages of ovarian epithelial cancer. And this cancer has four main stages, but it's important to focus on the last two stages because about 90% of women are diagnosed in the advanced stages. And this is because the cancer progresses fairly quickly, therefore the symptoms do not make themselves known until further on in the stages. Also, since the ovaries are fairly small, the tumor does not make itself known until it is big enough to be life-threatening. The next theme I explored is optimal and complete cytoreductive surgery. So in order for it to be determined or classified as optimal, there has to be at least 1 centimeter or less in diameter of the tumor left in the body. And this has caused a lot of question as to whether or not the surgery is as effective as it seems because there is a piece of the tumor still left in the body. However, research shows that women that go through with this surgery have a higher chance of survival in comparison to women who don't. Even if the women are left with more than 1 centimeter left of the tumor, they still have a higher chance of survival. Also, in decreasing the mass size of the tumor, it makes the chemotherapy more effective because there is less to attack, and it also decreases the blood supply, which thus decreases the growth rate of the cancer cells. The last theme that I explored is chemotherapy, which again is used in combination with surgery to treat this cancer. And there are two main chemotherapies used, and they are neoadjuvant and adjuvant. So neoadjuvant is usually given before the surgery, and this is designed to shrink the tumor. And adjuvant chemotherapy is usually given after the surgery in hopes of preventing the cancer from coming back. And there has been a lot of question and experiments done to see whether or not this chemotherapy can work alone rather than with the surgery. And after completing many experiments, research shows that this chemotherapy is as effective as the surgery. However, it can make the surgery harder afterwards and also can cause the cancer to grow a resistance towards the chemotherapy that follows the surgery. So in conclusion, although there are many types of treatment that can be used to treat this cancer, cytoreductive surgery is the most effective because it decreases the size of the tumor and provides more benefits in comparison to other treatments such as chemotherapy.